All right, guys, welcome to our Poop Scoop Monday. We have a great show today. We'll discuss, I'm going to do a deep dive on a liver condition called cirrhosis. You may be wondering if you have this, what are the risk factors, how do we treat this? We'll also discuss the benefits of squatting. Yes, I am a huge fan of squatting. It can do more than just help out when it comes to rectum issues as well. We'll talk about constipation. We'll discuss some of the risk factors and some of the natural options you can do to get your constipation taken care of. And we will do a review of my breakfast. If you're wondering what a GI doctor eats for breakfast, this video is for you, and we'll answer your questions live on today's Poop Tip Monday or Poop Scoop Monday. Haven't quite decided what I'm going to call this yet. Howdy, y'all. Dr. Islam here, aka your poop guru and your gut microbiome expert. Yay! Well, thank you guys for joining me today. Every Monday I go live on my social media streams, answer your questions you guys may have. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter. And can see us a little bit gastro, where we can figure out what's going on inside your GI tract. So thank you for watching. Let me know if you're watching this live or on the replay. And also let me know where you guys are watching this at as well. I want to see where the furthest person is at who's watching either the live stream or the replay as well. So hope you guys had a great weekend. My weekend was great. It was restful. So I'm in the middle of the huge Elon Musk book. It is a massive book. And let me tell you, it sucks to be a billionaire, the world's richest man. Oh my goodness. His life is not something that I would ever want. There is so much stress he is on a daily basis. I mean, he's like literally vomiting up his stress, developing gut issues, heartburn. He just can't ever rest. He doesn't ever seem happy. Oh my goodness. Lesson learned. Don't be in charge of like $5 billion companies, because it's going to make you go really insane. Also make you very, very stressed. But it's a very good biography. I love reading books. Let me know in the comments down below if you guys have a good book, or if you're reading the Elon Musk biography as well. It's been a great biography. It's a lot of lessons I'm learning about what not to do, but also just interesting to obviously, to hear about him. And I'm right now in the very end where we're talking about Twitter and his acquisition of Twitter. Also, I am starting to introduce my family to some of the classic movies. So let me know in the comments down below if you have a movie you want me to recommend or watch. So I introduced my wife, I can't believe she's never seen this, to The Usual Suspects. Wow, I love this movie. It's one of my most favorite movies. It's one of my favorite movies that I've ever watched, and my wife got blown away. I'm not going to give away the ending, but if you've not seen this movie, holy moly, it stands the test of time. One of my favorite movies. I know some of the actors, there are some really horrible things that they've done in real life, but if you look at the movie in and of itself, it is a classic movie. So let me know in the comments down below if you've seen this, or if you have any other movies that you recommend for me to watch, to continue with my movie night that we're doing every week and trying to introduce my kids and my wife to some of the classic movies that are out there. And so I have a list going on as well. So Christina, thank you for watching. Aiden, good seeing you. Raymond, good seeing you from Idaho. Michelle, good seeing you as well. And I'll ask you guys, and I'll answer some of the questions you guys may have as well. So topic number one, every week I try to do a deep dive into a topic to give you more in-depth information for this. So today's topic is my deep dive. Sorry, I'm going to do this again. So in today's topic, I'm going to do a deep dive. This deep dive will be the deep dive on cirrhosis. What exactly is cirrhosis? What are the risk factors? How do we diagnose cirrhosis? And how do we treat cirrhosis? And I'll answer your questions as well. So first of all, what is cirrhosis? Cirrhosis is end-stage liver disease or liver failure. And so there are different stages that your liver can go through until it gets cirrhosis. And all the way up until cirrhosis, your liver can be reversed depending on lifestyle changes, dietary changes, and sometimes medications. But once you have cirrhosis, that is scarring of the liver, and once you have that scarring, you cannot go back. And so you have different degrees of cirrhosis based on what's called the MELD score, MELD. But basically, once you have cirrhosis, the ship's kind of already left. You already have the scarring, and there's not a lot that you can do to get it back to normal again. So if you have cirrhosis, my job as a liver specialist is to do what I can to keep your cirrhosis at bay and to make sure it doesn't get any worse or you don't have any significant complications from that. So what exactly are the risk factors for cirrhosis? Let me know in the comments down below if you think you know what the risk factors are. So we know that alcohol, especially chronic alcohol use, can lead to cirrhosis. We also know that viruses like hepatitis C or hepatitis B can lead to cirrhosis as well. We also know there are some genetic abnormalities like hemochromatosis or Wilson's disease that can lead you to have cirrhosis. There are some autoimmune diseases that can lead to cirrhosis, including autoimmune hepatitis. But the number one most common reason for individuals that have liver failure is fatty liver disease. Yes, that's crazy, but fat over time can cause scarring to occur, and that has been shown in the past number of years to be the number one cause of liver failure and cirrhosis in the United States. So as the fat accumulates in the liver, it can cause damage, scarring, and eventually lead to what's called liver failure. And this used to not be the case, but with the rise of the obesity epidemic, we can see that more and more individuals are getting cirrhosis from fatty liver disease. And the scary thing about this is that it doesn't cause symptoms until it's too late. So how does one diagnose cirrhosis? So typically it's a combination of blood testing, imaging, and a physical exam. So we'll start with the easiest thing, physical exam. There are some things we can see on the physical exam that make us think that you have cirrhosis. Yellowing of the skin, yellowing of the eyes. Your palms are very, very red. It's called palmar erythema. You can develop what are called spider angiomas, small little red spots around your chest area that's there. You can have what's called ascites or fluid around the belly or edema in the legs. These are very common physical findings that I see with cirrhosis. So when I see somebody in the clinic who has liver disease, I check for these things to see if there's any concerns about liver cirrhosis. And if there is, we'll typically do imaging, whether it's an ultrasound or an MRI or a CAT scan, to allow us to see the texture of the liver. And there's certain characteristics that we can see on the imaging test that tells us, hey, this person has cirrhosis, whether it's a shrunken liver, a scarred liver, or a coarse liver. These are like kind of buzzwords that we see or that we read about when it comes to liver disease on the imaging test that gives us a better idea if you have cirrhosis. Also, blood testing would give us a better idea if you have cirrhosis. If your platelets are low, one of the more common reasons is cirrhosis. If your albumin is high, if your albumin is low, your liver can't make liver. If your albumin is low, your liver cannot make proteins, and that can cause you to have a sign of cirrhosis. If you have problems with anemia, that could be a sign of cirrhosis as well. If you notice that your protein is low, if we notice that your protein is low, that could be a sign of cirrhosis. So if your clotting factors are out of whack, that could be a sign of cirrhosis. And for those individuals in which we're not quite sure if you have cirrhosis, or we're not quite sure the cause of that, we may want to consider doing what's called a liver biopsy, where we can take a sample of your liver to look at under the microscope, and in there we can see the scarring that's occurred. Typically, you try to avoid a liver biopsy if we can find non-invasive measures, whether it's imaging, blood testing, or physical exam, but sometimes we do need to do a liver biopsy for us to actually look at the liver itself to determine, A, do you have cirrhosis? B, the degree of cirrhosis, and C, the potential cause of your cirrhosis, so we can fully understand what we can do to get your liver taken care of. So, what are some complications that can occur with cirrhosis? There are a couple of things you should be aware of. I mentioned one already, one called ascites. This is fluid around the belly. It's as if you are pregnant. You have this pregnant belly that's full of fluid that is called ascites, and also it can lead to edema as well. A second complication is called varices. These are dilated veins in the esophagus, almost like varicose veins, that unfortunately are a very common reason why people pass away from cirrhosis, because they just vomit up that blood. And the only way for us to know this, if you have this, is to do what's called an upper endoscopy or an EGD to see what's going on. Number 3 is called encephalopathy or confusion. This is very commonly occurring because your liver's main function is to detoxify, to get rid of toxins. And if you have cirrhosis, you're not able to do that job. And so you accumulate toxins inside your body, which can lead to confusion, altered mental status, just not being with it, which is a very common complication of cirrhosis. Then lastly, another complication is cancer of the liver called hepatocellular carcinoma. And so everyone who has cirrhosis would typically do imaging and blood testing every 6 months to see if we can find this before it becomes something bad. And anybody who has cirrhosis is at risk of developing this. And these are the major complications that occur with cirrhosis. And there are other complications that can occur, including other things like muscle wasting, slowness at the gait, just not having mobility and things like that. But these are the main complications that we find in somebody who has cirrhosis. So what do we do? How do we treat cirrhosis? Well, obviously, we want to treat the complications. So if you have ascites, we'll give you medications to help pee out that fluid. If you have confusion, we'll give you medications like a medication called lactulose to help you detoxify your body. If you have cancer, we'll treat that. Or if you have what are called varices, we can do an EGD and scrunch up those varices and put you on medication to decrease that. But the ultimate treatment is a liver transplant. And there are a couple different reasons or criteria that we use to help determine if someone's the right candidate, whether we can figure out if their cause is related to alcohol or not, their comorbidities, how much functional status that they have, what stage is their liver, do they have good family support, and a lot of things that play a role. And so there's a huge committee, a large committee that helps to determine if an individual is the right candidate for a liver transplant. And I've been involved in those committees, and I understand it's a very in-depth process because we want to make sure that we do the right thing for you, because livers are so limited that we can't give them to everybody, unfortunately. But liver transplant is the ultimate treatment when it comes to cirrhosis. Now that we talked about this, what can you do to make sure you don't develop cirrhosis? Here are 5 things I recommend. So number 1, don't drink alcohol. Alcohol can trigger liver disease and can add on to liver disease that you may already have. It can make things worse. So don't drink alcohol. If you have any sort of liver problem, I'm sorry, don't drink it. It's not going to be the good thing for you. Number 2, do not take a liver cleanse or a liver detox. Unfortunately, I've sent a large number of patients to get a liver transplant because they took a liver detox. They actually killed their liver by doing that, so don't do that. Number 3, minimize your risk factors for fatty liver disease. Lose weight, exercise, go on a Mediterranean diet. These are things that have been shown to help out with clinical trials to decrease your risk for developing cirrhosis and fatty liver disease. Number 4, incorporate black coffee. Black coffee has been shown in multiple studies to help out with stopping the progression of liver disease, and also has been shown to help decrease your risk for developing fatty liver disease as well. So 3 to 4 cups of black coffee per day is going to do wonders for your liver and your health. And then lastly, exercise. Go out, go for a walk, do what you can to be healthy, because this will help prevent you from developing liver cirrhosis. So these are things that I recommend as a liver specialist to make sure you don't develop liver failure. Let me know in the comments down below if you have any questions about cirrhosis, the complications, and the treatments. I'm more than happy to answer those questions. So I want to thank you guys for that. So if you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. Every Monday I go live to answer your questions you guys may have and go into topics as well. If you haven't already, don't forget to smash that like button, like, share, and subscribe, and come see us a little bit. I cannot speak. Oh my gosh. Come see us a little bit Gastro, where we can take care of all your GI needs. So you have a question here. Hey, Dr. Islam, do hemorrhoids come and go? Yes, they do. So hemorrhoids, once you've had symptoms, it's not a matter of if, it's a matter of when they come back. So symptoms include pain, bleeding, itching, and pressure. And if you have that, I will guarantee you those symptoms will come back unless you actually get rid of those hemorrhoids. Now, there are 2 ways to get rid of them. One of them is surgery, which we don't recommend for anybody because it is literally a pain in the butt. But come see us where we can do what's called hemorrhoid banding, where it's quick, easy, and painless. It takes about 10 seconds to do, and in 90% of our patients, it gets rid of all their hemorrhoids for the rest of their life. So if you're having hemorrhoid issues, you can certainly do over-the-counter treatments. But it's not going to fix the problem. It'll just delay the inevitable. But come see us where we can find out what we can do to get your hemorrhoids taken care of. And we're more than happy to get that squared away for you as well. So I hope that answered your question. All right. Perfect. So question number 2. The benefits of squatting. All right. Let's talk about this. So I am a big fan of squatting for a lot of different reasons, but most importantly, it can help out when it comes to bowel issues. So what squatting does, it actually helps out with the natural alignment of your body. For centuries, millions of centuries, we didn't have a toilet bowl. So guess what we did? We dug a hole and we squatted and we used the restroom. So our body was used to that, and it was made into an evolution where the squatting actually helps to relax the muscle called the puborectalis muscle to allow this to help change the angle of the rectum to make it go into a slide. And that's exactly what a squatting does. And this is done in multiple countries that typically don't have a toilet bowl as their main means of evacuation. And so our evolutionary ancestors really relied on squatting as the most effective way to use the restroom. And because of our incorporation of a toilet bowl, which I'm happy with, trust me, we've lost that ability to change that angle. So whatever you can do to help out with squatting is going to help out. Here are my recommendations. Number 1, use something to actually help elevate your knees. If you can get your knees above where your rectum is at, that's going to help out to change up that angle to help you squat. That's number 1. Number 2, consider using a squatty potty. It works. They're effective. They're available over the counter, about $25. If you go to my website, Lubbock Gastro, and look on Dr. Islam's favorite things, I have some information on some of the squatty potties that I recommend as well, but it actually does work as well. Or number 3, if you want to add some a stool, that's all you have to do because that's all you need. But if you can develop the habit of squatting more when you use the restroom, this is one of my recommendations that I recommend to help out when it comes to bowel issues, especially if you're having issues with hemorrhoids, constipation, and using the restroom. Let me know in the comments down below if you've tried something like this, if it's worked or it hasn't worked. I'd love to hear what you guys have to say. So that is a great question. I'm so glad that you asked that as well. If you're joining for the first time, my name is Dr. Islam. Yes, I am your poop guru. Every Monday I go live to answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Don't forget to let me know if you're watching this live or on the replay. And also, come see us at Lubbock Gastro, where we can take care of all your GI needs. All right. Perfect. So Christina asks, is biliary cirrhosis the same as liver cirrhosis? Kind of. There's a specific name for that, and so that may be something else that you may be thinking about as well. All right. Next question. Understanding constipation. What causes it, and what are some lifestyle changes that can maybe make your constipation better? So let's talk about this. What causes constipation? There are a couple of things that can cause constipation. Number 1 is diet. If you eat like crap, you're going to feel like crap, and you're going to poop like crap. So the more bad food you incorporate into your diet, the more likely it's going to be for you to have more difficulty using the restroom. So you really need to change your diet. Adding more fiber, adding more roughage, adding more plants and vegetables is the first line treat that we recommend for helping out with constipation. Changing your diet is going to make a difference. Number 2, changing your lifestyle habits when you use the restroom. So your body thrives on rhythm. And if you don't go to the restroom at the same time every single day, your body gets confused. Your colon gets confused. So try to establish a regular rhythm to use the restroom at the same time, at the same area, every single day. Number 3, having a sedentary lifestyle can also impair your colon and make things slower. So if you're not moving around, you're not going for a walk, you're not exercising, you're doing things harmful to your colon. So incorporating active lifestyles is going to help out to make sure everything's doing okay. Number 4, being low in magnesium, not taking enough magnesium can play a significant role when it comes to constipation. So consider adding some magnesium to make your stool softer and allow it to go through a lot easier. However, always remember to do this under the healthcare supervision of a healthcare provider. And then lastly, add a stimulant to help you use the restroom, whether it's a Miralax or magnesium to allow you to go, that's going to help out with your bowel habits. These are lifestyle things that we recommend. There are some natural options to help you go. So one of the things I recommend is try to incorporate coffee in the morning. Hot coffee or hot tea can activate what's called the gastrocolic reflex, in which actually helps to stimulate your stomach and your colon to pass things along through a lot easier and a lot more effectively. Coffee is one of the most effective things that you can do. Number 2, add some fiber into your diet in every meal, whether it's flaxseed, chia seed, or fiber supplementation. Add something like fiber in every meal to make sure you can get the ingredients and make sure you can get the fiber that you can use to help you use the restroom. Next, try to incorporate some magnesium under the supervision of a healthcare provider. Magnesium citrate or magnesium glycinate tend to be the most effective magnesium that I have found when it comes to helping out with bowel issues. So always remember, talk to your healthcare provider before you implement something like that. And also adding certain foods like prunes or kiwis have been shown in clinical trials to give you enough fiber and also some artificial sweeteners to allow you to have the restroom and use the restroom more effectively as well. And then lastly, always remember to hydrate. Hydration is critical when it comes to constipation. Drink enough water. You don't have to go overboard when it comes to this, but make sure you're not dehydrated so we can give you the type of lubrication that you need to give you a better bowel movement. Let me know in the comments down below if this has helped you, if you tried this, or you have other natural tips when it comes to constipation as well. Love to hear what you guys have to say. Alright guys, if you're joining for the first time, my name is Dr. Islam. Yes, I am your poop guru. My passion is to give you guys accurate information that's based on actual science and not bro science or social media science as well. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter, or come see us, Love the Gastro, where we can find out what's going on and hopefully get you taken care of. Let me know if you're watching this live or on the replay and where you guys are watching this at as well. So far, Guyana, Christine, is the winner so far, so thank you for watching that as well. Perfect. So Brooke asks, should I eat 2 cups of kale a day? Should I be concerned about too much vitamin A for the liver? Great question. So I want to give you kudos for you for incorporating kale into your diet. This is fantastic, not only for your liver, but for your gut health. Now, there is some minor risk factors with having too much of vitamin A. I will tell you, if you have vitamin A through food, your body does a fantastic job of making sure you're not having too much, as long as you don't supplement this with extra vitamin A supplementation. However, the easiest thing to do is just have your doctor check a vitamin A level and just see where it's at. I would bet you it's going to be okay, but I want to give you kudos for adding kale to your diet. Great job. All right, perfect. So let's talk about my food diary. What do I, as a GI doctor, have for breakfast? So let's talk about this. Or what I eat for a day. So let me talk about this. So I embrace intermittent fasting. I'm a huge fan of intermittent fasting, and I recommend this to as many patients as I can, especially those of my patients who are overweight or have fatty liver disease. And basically what it involves is just skipping one particular meal. Actually, hold on. Let me check something really quick. Sorry, I think my camera went off. Give me one quick second here. All right, camera's back on. I'm back. Sorry about that. So one of my cameras went off. So let's talk about this one more time. So Dr. Islam, a GI doctor, is going to reveal his meals throughout the day. So let me go over my principles. So number 1, I'm a big component of intermittent fasting. Basically, I skip one meal per day to allow me to make sure I don't overeat, but it gives me the fast that I do to make me feel better as well. Number 2, I do one 24-hour fast every single week. So today, Monday, is when I'm doing my 24-hour fast. So I'm about to break this after I'm done with this video. Number 3, I try to not do any snacking throughout the day. Number 4, I try to incorporate as much fruits and vegetables in every single diet and every single meal that I can. And number 5, I try to keep things simple. I eat the same thing pretty much every single day. These are my 5 principles on what I eat. So what I do today. So today I knew I was going to be fasting. So this morning I had my coffee. I always have my coffee because I love coffee. Coffee's great for me. It's black, helps out with my liver, gets me going. Number 2 is that I had 4 egg whites with some turkey on there as well because I needed the protein because I'm trying to get swole and strong, but also I knew I needed the energy all throughout the day. Today, because I fasted, I didn't eat lunch, I didn't snack, I didn't have anything else, and I'm going to have my dinner, which typically will be a high-protein dinner with lots of vegetables and lots of salad. I'm really big into that because that gives me the protein, it gives me the roughage and the fiber that I need to give me what I need to do. But that's my Monday. My every other day, my Tuesday through Sunday, here's what I do. So number 1, I get up in the morning and have coffee. I always have coffee. I love my coffee. And I typically have egg whites with some sort of protein on top of that to give me breakfast. Now in the past, I used to skip breakfast, but I came to realize that I need breakfast to get me going throughout the day because the meal I do skip is I skip lunch. I typically don't have lunch. I like to work through lunch because I like to just go ahead and get things going. And so typically during lunch, at most I may have is a protein shake, give me the protein that I need, but I don't have anything for lunch most of the time. And then I go ahead and have dinner, which is typically around 7 p.m. And once again, dinner is a high protein, medium carbohydrate meal with lots of fruits and vegetables. Now I try to increase my carbohydrates at the end of the day because it helps me sleep. I know for me, I need to sleep. And I know for me, having lots of carbohydrates allows me to sleep. But I'm very careful about my carbohydrates. I don't eat just like Pop-Tarts. I don't eat like croissants. I'm very careful. It's white rice or it is sweet potatoes. It is a healthy carbohydrate that's going to allow me to sleep longer, to be lasting inside my belly, and to give me the satisfaction that I need. And I do this pretty much every single day. Now on Saturdays, we typically have a family dinner, which we get with my in-laws, and that's when I'll eat pretty much what I want. But every other day, I eat the exact same thing. I am boring, but I would much prefer boring and healthy. The excitement of trying to do different things and realize that I'm really just messing myself up overall. So this is my typical thing that I eat on a daily basis. If you want more videos like this, comment down below. Let me know what other things you want to hear about and let me know what you guys think. All right. Perfect. I think we're good. All right, guys. I want to thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And I'll see you guys next week. Have a great day and can see us love a gas show for all your GI needs.